For centuries, heat has been used to treat medical conditions, but now there is an advanced procedure that sounds a little bit like science fiction, but it is actually reality. It's called radiofrequency ablation. Dr. Dean Mariano is a pain management specialist at the Spine and Pain Institute at Midstate Medical Center. He joins us now on the show. Nice to have you here.
Thank you.
So pain management is a topic a lot of people can relate to, whether it's your hip or your back or anything like that. What initially causes the pain, would you say?
Most of the times for the areas that we treat with this, with the spine, the joints, and sometimes with headache, it's usually related to arthritis. As we get older, arthritic changes start happening in the joint areas and they become very painful. Sometimes, especially with headaches, it can be also caused from a motor vehicle accident where you have a, quote, whiplash phenomenon where you strain the joints and they become very painful and tender and develop headaches and a sore neck, which a lot of times people can't figure out why it's happening because the MRI is always normal looking.
Oh, sure.
And so we are able to figure out how to treat these conditions more appropriately and diagnose them correctly and then provide the correct treatment in the future.
So before you had this new procedure, what was the old way of dealing with pain?
For the most part, it was a lot of, which we still do nowadays, it's still physical therapy, using certain medications such as non-steroidals and muscle relaxants, certain types of steroid injections, which we still will do prior to performing this procedure for diagnosis and confirmation of diagnosis, prior to seeing if the patient is a candidate for this procedure. This procedure allows a longer duration of improvement in pain treatment if the patient is responsive to the diagnostic injections.
All right, well, let's get right into it. What is happening with the imaging?
Well, with radiofrequency, what we're looking at, especially when we're looking at the spine, the spine is basically multiple bones held together by discs on one side and joints on the other. It's kind of like if you ever stacked a bunch of Legos on top of each other.
Right,
which I think we all have. So where we're focusing on is the joint structures of the spine, the ones that allow the bones to literally bend. Those are the areas where they have the arthritis located at, or the strain, or the problem. So what we end up doing is we've image the patient, we find out exactly what conditions are causing the problem. Our physical exam kind of confirms our ideas of what's happening there, and then we proceed with certain diagnostic injections where we do test blocks, where we go down to those joints and place Novocaine in them, or around the nerves, make the joints go numb, and then literally ask the patient, is your pain better? Is your headache better? Can you walk on your knee? Can you bend your hip? And then find out if they would be a candidate for the radiofrequency procedure. The radiofrequency procedure is just using a specialized needles down to those areas where those nerves are located that supply the joint with its innervation or its pain sensation.
Sure.
We locate those nerves and then destroy them.
Got it. And if you go through with the actual procedure, do you feel this? Is it something that's painful, or?
There's certain parts during the procedure where it might be a little uncomfortable when we're placing the needles, but it's all done under local, and we do have to test each nerve. But once we're doing the procedure, we place Novocaine into the air to make it kind of go numb first. So most of my patients literally just lay there and just say, I really don't feel anything.
That's great. And who's a good candidate for this?
Pretty much a lot of people. I mean, after age 65, the reasons why most people have back pain is related to facet issues and also something called sacroiliac joints, if anyone's ever heard about that. So anyone who has arthritic changes to those joints, pain in those areas, when we're specifically talking about the knees and hips, people that are either pre-knee replacement, we might be able to do some things to the knee or to the hip to help with post-op pain control before hip replacement. We have people that have had hip and knee replacements who still continue to have pain in the knee or hip, which we can hopefully benefit and improve their pain. And also people that won't qualify for the surgery. Either they have other medical conditions that prevent them from having the surgery, or the hip or the knee is not bad enough to warrant surgery yet. We might be able to give them some time with some pain relief.
A little bit of relief, sure.
Yeah.
Now, how long does the treatment take? Is it one procedure? Do you have to keep going back?
Well, first we do the diagnosis, like we said, and if they're a candidate, the actual radiofrequency procedure takes about 30 minutes to an hour, depending on what we're doing and what levels and how many levels we're doing. The procedure lasts anywhere from about 6 months to 2.5 years.
Oh, wow. And are the results instant? Is someone walking off and saying, this is fantastic, I don't feel anything anymore?
Sometimes, yes, but the problem with that is it's usually the local anesthetic that we've placed in there to make it kind of go numb before we've actually do the procedure.
You still can't feel it yet.
So some people will have results very quickly. On average, it takes about 4 to 6 weeks for everything to fully set up.
Sure. And doctor, what's the feedback you've gotten from patients who've had this done?
Wonderful, actually. I
Really?
mean, people have said to me that I can't believe I can actually bend my back and move and get up and play with my kids. The quality of lives have improved, and this is all minimally invasive. And it's using needles. It's not surgical. It's done in our office suite. The results can be long-standing. The main goal of any of these procedures is to improve function and quality of life and decrease pain, and hopefully not have to use medications at the same time.
There you go. Let's put some information up on the screen. The Spine and Pain Institute at Mid-State Medical Center is located in Meriden. For more info, you can call 1-800-DOCTORS or visit midstatemedical.org. Dr. Mariano, Dr. Dean, whichever you prefer. Thanks
Fine.
for being here.